everyone know who just joined one more time. If you see at the top of your screen, we are using a website today called Mentee to enhance some of our discussion together. We invite you to please go to a new browser on your internet or to your phone and type in www.mentee.com that you should see here on your Zoom screen, and type in the code at the top of the screen, and that will invite you to our conversation platform. And you should see a prompt for you to enter your name, organization, and where you're located. And while you're doing that, we'll be using this platform throughout our conversation. I'm going to pass the opening over to our President, Robert.
Good afternoon or good morning, wherever you are right now. I saw we had some folks on from Alaska, so welcome. And you'll forgive me, I'm a little nasalized. My allergies are killing me. My name is Robert Boyd. I am the president of the School-Based Health Alliance. On behalf of our board and staff, I want to welcome you to today's SBHC peer-to-peer listening and learning session. We're glad you've joined us. Today, we also have representatives from our SBHA state affiliates, different state program offices, and some Alliance board members are joining us as well. We're hosting these listening and learning sessions every week. And while the Alliance doesn't have all of the answers, nobody does, we want to provide support to SBHCs by connecting like-minded individuals and facilitating peer-to-peer virtual listening and learning meetings where you, sponsors and administrators of SBHCs, can come together to discuss and share how you're responding to COVID-19. Please know that there are no right or wrong answers to any of the questions we're going to ask you today. We're interested in learning more about your individual experiences and your opinions. I'd like to introduce our three facilitators for today. You've already met Andrea. Andrea Shore is our VP of Programs, and Paula Fields, our Director of Programs, and Miranda Robinson-Perez, one of our program managers, are going to be facilitating the conversation on the chat box. But Andrea is going to facilitate the oral conversation, so I'm going to pass this on to Andrea right now. Thanks to all of you for joining us, and please be safe.
Thank you, Robert. Welcome again today. We are the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to health care services. School-based health care is the solution, bringing health care to where students already spend a majority of their time, in school. Here's an overview of today's agenda. I'm going to share with you where to find our COVID-19 resources, talk to you a little bit about how to use Zoom today, and share some information with you about how we'll follow up to this group after the session, dive into our discussion questions, and do a little bit of reflection and share with you upcoming listening and learning conversation dates. The Alliance remains open and working to meet the needs of our field. For more COVID-specific information and updates for school-based health centers and Alliance efforts, you can visit our website. Here's a snapshot on the screen to give you a little sense of what our page looks like. And we're adding more resources to this all the time. So we are using the Zoom platform today, and we will be recording this session, and we'll place it on our website after the meeting. As you entered the meeting today, you're in mute, but you will have the ability to unmute yourself and join our conversation at any point today. We're going to invite you to participate, if you've not already, in our Mentee Questions, and use the chat box to ask questions and share thoughts throughout. Mentee is a platform where we can collect your responses, and then we're going to call on you to share some more, either in the chat box or by unmuting yourself to share even more or ask questions of your peers. Okay, great. Oh, can we go back to that? Oh, we don't need that Zoom one. Okay. Okay, great. Thank you. So after the call today, we're going to send you a follow-up email containing the slides and a link to our COVID-19 resources page. We'll share a recording of this call with you and a link to where you can find that on our website. And then we're going to send you a link so that you can join our Basecamp group, which allows for continued collaboration and resource sharing. Basecamp is a real-time online communication tool that helps teams stay on the same page. It fosters collaboration and resource sharing, and we're uploading resources both from people in the field and that we are gathering as well. And so we do invite you there, and we're collecting them and sorting them by resource topics related to COVID-19. Okay, so as you already know, today's topic is reentry for school-based health centers. And there are so many unknowns for reentry, and we're all trying to think about this, but we recognize that most organizations and school districts don't have the answers yet. This topic was highly rated as for this week's conversations based on last week's listening and learning session. So we did want to give an opportunity for the field to come together and discuss reentry. Today might be the opportunity to collect your concerns and questions and then perhaps visit later in the summer. We're looking forward to hearing your thoughts about reentry today and seeing what people are hearing and possibly even starting to think about within your organizations. Okay, so for those of us who have joined a little bit after the start, we're going to ask everyone to please pull up a web browser or your phone, and we're going to invite you to go to the website Mentee, MENTI.com, and there's a code at the top of your screen. If you type in that code, you will join into our conversation, and that's where we'll be asking you some facilitated conversations throughout, collect your responses, and then we'll call on people to share more in the chat box. So if you can go ahead and do that and enter your name and your organization and where you're from, we'll give everyone a few minutes. It looks like 19 people are logged into Mentee so far, so we'll give a few more minutes for the rest of you to go ahead and get onto the website. If you do have any trouble getting into Mentee, we invite you to use the chat box, which is at the bottom of your Zoom screen, and you can type in and share your name and organization through that mechanism if you have trouble getting into Mentee. And again, we will use the chat box throughout for conversations as well. But if you can get into Mentee, we would greatly appreciate it. We have heard from people that the phone is sometimes easier than pulling up a separate browser, so whichever works better for you, to go to mentee.com and enter the code 333838, please. Okay. Let's see. It looks like we've got 26 people. Give one more minute to go to mentee.com, please. All right, we're up to 27. Okay, we'll go ahead and move on to our first question, and you can join Mentee at any point in time again, using the code at the top of the Zoom screen so that you can enter your answers into Mentee, and you also can enter them at any point in time to the chat box. Feel free to please ask each other questions to expand on ideas and thoughts shared through the chat box, or you may unmute yourself at any point in time. If you do unmute yourself, please mute yourself when you're done sharing. Our first question is starting out by just asking how you're feeling about your work in school-based healthcare. We'd ask you to enter a few words just to share with each other how you're feeling today. You'll see on our word cloud here that some words are getting larger, and that means multiple people are responding with that answer. I see hopeful at the middle, growing big, which is nice to see. I see uncertain in the chat box. Thank you for sharing. Hopeful, overwhelmed, uncertain, anxious, underutilized. Yes. Okay, thank you so much for sharing. We want to give a moment and space for people to express their feelings in these challenging times. We're going to move on to our next question, please. And you might have to click at the bottom of your screen to prompt you to go to the next question if you're not seeing it at the top of your Mentee screen. You should see a question now that asks, what are your immediate challenges, concerns, or fears related to COVID-19 and school-based health center reentry? Please take a few moments to enter this. I see a lot of people are entering funding, staffing, just the new school year in general. Yes. Looks like funding is definitely staying towards the top of the list. Okay, thank you so much for sharing your responses here. We're going to start opening up to some questions, particularly related to reentry, and some of those will start to touch on these concerns that you put in here. So the first question we'd like to dive into open discussion about today, and we'll begin with your entering information into Mentee, is what are you hearing about schools and reentry? Anything you want to share here about just what are you hearing in general about reentry? Look like some people are saying they're not hearing anything yet and not sure when you'll return. Universal screenings. Many sectors and schools creating their own plans and not much coordination. Yes, thank you. I see in the chat box, schools are closed for the rest of the academic year. Yes. Hearing different things, but I've not seen a lot of specifics. Does anyone want to unmute themselves and share more about what you're hearing? The staggering students is very interesting. I've heard that from a few different locations as well. Is anyone hearing anything specific about that?
Hi, this is Jane Highland from Connecticut.
Okay,
We just got word that our schools are not going back this year. So they kind of held out. They were gonna, I think, announce it May 20th, but so we just heard that today. I'm hearing things like the staggering, that there may need to be some masks, that there'll be lots more disinfecting of school spaces and classrooms. I mean, many of the words that you're seeing on the screen here, it may look very different. I think it will. So that's my update from Connecticut.
Thank you, Jane. I see that Molly Tickner joined us from Missouri. Molly, I'm not sure if you're unable to mute yourself, but I know that you've got some reentry plans that started to be formed in Missouri that I'm wondering if you could share a bit more with the group about.
Sure, no problem. So yeah, we actually are super excited to say that the governor created a task force that was comprised of many state agencies to start thinking about reentry. Our schools have officially closed for the remainder of the year, and potentially through, there will be no summer school. That hasn't been officially informed yet. So they're preparing for reentry for the fall. And so that the task force led to the Missouri School Board Association, which is actually one of our board members and is actually our employer for a few of our staff here at the Alliance, the statewide school-based health alliance. So their Center for Education Safety put together a task force, and we were able to be a part of that. And a reentry plan was drafted and shared with the governor and Senator Blunt. Edits were made and revisions were made, and after several months of hard work, the document is now live, and it's available. We put out a blast on our listserv, and it's available on the Missouri School Board Association website, and they will share it with all of the schools in the state of Missouri, the school administrators and the board members. It is a very comprehensive document that focuses anywhere from operations to health, education, academics. What if we go virtual? What does that look like? So it's a transportation, anywhere from how you handle the cafeteria. We pulled information and utilized many resources from the Missouri foundations, as well as the stakeholders, to utilize the information that they already had, whether that be from the CDC or our Division of Health and Social Services, the Missouri Association of School Nurses and School Counselors. So we were able to pull in a lot of resources and templates that were already being created. So we're hoping that once that document goes out to schools, we are able to start and we can start now sharing it with our providers, especially those that are school-based health providers. They're asking how they can help. They want to know how they help with screenings, or how they can help with immunizations, which is a big concern here in the state of Missouri, much like other states. So we've already had conversations with the Missouri chapter of the Pediatrics Association. I had a conversation with them this morning, and our Missouri Association of Rural Healthcare Providers. I had a conversation with them this morning, so they can get the word out to their members to start reaching out to the schools. So to say, hey, we know you have this document, because one thing that we were really focused on in this document was encouraging the schools to reach out to their partners, to reach out to the healthcare providers, reach out to, if they already do have a school-based health provider, reach out to them, reach out to their local health departments, and the key stakeholders in their community, so that they can leverage their resources, that the schools are not in this alone. We're also hoping, because there is such a large emphasis on the healthcare and mental health preparedness and for reentry, that this is something that our school-based health programs also can utilize as they draft their own, as well as the resources that National Alliance has already started to create. So it's progress. Our schools have been screaming for it, and our providers are really looking for something to help. And so I think it's going to give them a good guideline. As always, with any resource or any toolkit, it needs to be taken in consideration that it's not a how-to guide. That was the other area of focus that we were very clear with the governor's task force on, is that every community is different, every school is different, and a lot of schools have the resources available to, have a really active communications plan and have a full-time media person, but some don't. And so we did our best to encourage our schools to leverage their community resources, and we as an alliance are there as a resource as well to help prepare them. But this will hopefully start reducing some of the anxieties that people have about what do we do. So we can, I can share that link. I don't know how you would prefer for me to share that, but I can share the link to access the document because it is live and can be published.
Thank you so much. Tammy was reading your mind and she shared it in the chat box for you. So thank you, really. Yeah, teamwork. Thank you, Molly. That's actually incredible. I'm wondering if anyone else is hearing about other state task forces that might be collectively working on this. I see some people saying that there's different groups that are uncoordinated, but wondering if anyone else is hearing about some state level task forces like this. And feel free to unmute yourself if you have anything to share on that. Okay. I'm also wondering, I see a couple of notes going through here from Mentee about different vulnerable populations. One mentioning that there may potentially be priority given to students with special learning needs. Another mentioning that chronically ill children should not start until certain metrics are met. Can anyone chime in and share what they might be hearing about different segmented populations like this, different vulnerable populations, what they're hearing locally? Again, nothing has to be set in stone, but just what you might be hearing.
This is Heather Ireland in Anchorage. I was just commenting, my husband's a teacher, and we were talking about some of the life skills families, and that without that respite from sending their kids to school, they're not getting any breaks, and then that's got to be really trying. And he said that he heard a rumor that they're going to prioritize those students coming back into the schools just to give those families some support, but again with super strict distancing and masks and lots of other protections and cleaning and other protections in place.
Yeah, that's fascinating, right? I would imagine those parents or guardians are having an even more challenging time than those who do not have those special needs. Anyone else hearing about different prioritized groups of students?
This is Tammy from the School-Based Health Alliance. I would be interested to know from the Mentee comments, what state or what community is online through until January of 21? You can just unmute yourself and just chime in.
Yes, please.
because you know that your reentry will be delayed. Or if you can't chime in, you can chat it in the chat box. And then there was one that said that schools are starting in July, so that's a faster startup than most are expected.
Yes, anyone who could share about these alternative starting dates? It'd be great to hear what you're hearing locally. Yep, there it is. I see the question. Tammy was asking if anyone could please share who typed into Mentee that their school district might be online until January 2021. We'd be curious to hear what school district and where you're located. That's already declared that. Actually, I see that in a couple of boxes. If anyone could share who's delayed until January. No one chiming in? They're taking themselves off mute. Okay, if you do figure out how to take yourself off mute, we'd love to hear. Or as Tammy mentioned, you can put your response in the chat box about any different staggered timings that you might know of happening with your school district. Let's go ahead and move on to the next question, because I think that's going to encompass some more of what you've already started to share. If you can click on advance in your Mentee screen, it will prompt you to the next question, which is asking what approaches are you considering for reentry? Is your organization starting to have some of those conversations? What actual tangible approaches are you considering for reentry? Anything that you're open to sharing, please do in the Mentee question. Great, I see some responses coming in. A few talking about continuing telehealth visits. Soft start with less staff, thank you. Minimal possible staff, yeah. So one person chimed in here, I'd love to hear about this as others are entering, that they're speaking weekly with school systems and making sure they know that they want to be a part of the reopen plan. Could you unmute yourself and share whoever entered that? That's one of the details I'm curious about, if others are getting either invited to the table or trying to get themselves invited to the table, like Molly shared with task force or school district planning team. So whomever entered speaking with school systems weekly, could you please unmute yourself and share a little bit more about that?
Hi, this is Sandy. I'm in Georgia, North Georgia, up in the mountains. That was my response. Can everybody hear me okay?
Yes, great. Thank you, Sandy.
Okay. Well, we just have always prided ourselves on being seen as part of the school system, and we've really worked to be integrated with our school-based healthcare clinics. So we've continued to have conversations and check-ins with them weekly to see if there's anything they need, any special students they need, our assistance with. We are doing just strictly telehealth at our school-based, but we have 2 school-based health clinics. So, you know, it's part of just, you know, when they start having conversations around what will reopening look like, just making sure that, you know, if there's additional support they need from health, you know, the school-based health care center clinic, that we're there. We have a little bit of an unusual relationship with the school systems, I would say, in that we are able to see, they've allowed us to be able to see the community as well as the school-based students. So, and our school-based healthcare centers are in modulars and not actually in the school. So we see a lot of grandparents raising grandchildren, and we're able to be open through the summer as well. So just making sure that the school systems know that if they need additional support, you know, and helping them decide what, you know, the new school year will look like, that we're there. And it's, you know, very often they may call us and question us about something. Our health department in our areas are really very busy, and a lot of times we're the go-to instead of the health department for certain things with the schools. And we also help take care and work closely with the homeless school social workers and other children from other schools in the school system. So just, you know, I think it's just continuing to be there and let them know you're concerned, you're there for help. Right now, they're not certain what the fall will look like. Like I said, you know, they're still trying to get through this school year. They're still, you know, here in our area, they're planning to do graduation in July on the football fields if things if we don't have a resurgence. Most of you have heard that Georgia was one of the first ones to fully open up. So we're kind of holding our breath right now to see if we're going to have, you know, a big rebound and a lot of new diagnoses because things are opening up in the state of Georgia. So there's kind of an intentional pause right now, I think, on the two school systems we're in to see what is going to happen in the next 4 or 6 weeks. And they haven't made any concrete plans yet for what the fall of the school year of 2021 looks like.
Great, thank you.
Does that help?
Yes, very helpful. Thank you, Sandy. Yes, because I think just hearing what each other's starting to go through and how they're getting to the table is really, really helpful and important. Thank you. Is anybody else trying to, either through district wellness committees or through other relationships that might already exist, pushing to make sure that they're able to be at the table as part of these reentry plan, larger reentry plan conversations that they would want to share with the group?
Hi, this is Jane from Connecticut again. We have done 2 regular, pretty close to weekly communications to superintendents and principals in the districts we serve in Connecticut. We also have sat with one of our districts, all of their administrators and staff held 2 different mental health summits. And so it was really the teachers kind of bringing forward what they were seeing in the students as they provided their platform of virtual educational pieces. And, you know, it was interesting to hear that, you know, some of the kids that they weren't concerned about while school was in session, they are now concerned about, and the flip side as well. And so we had the opportunity, and one of my behavioral health clinicians that serves that district was there, and it looks like we may have the opportunity to move from that summit to an actually community-wide forum where we can bring a couple of our pediatric specialists in to actually discuss what this kind of trauma can bring and what parents and other community members can start to look for. So it doesn't mean we're on the front line of startup, but at least we're very woven into that district in particular, but others too are sharing our correspondence and things with their families.
That's fascinating, Jane. How are they, how did they do the mental health summit? Was it just through Zoom or something like that?
Yeah, it was just through Zoom, and I'm gonna say it's a smaller district, so it was through Zoom. So I want to say maybe there were 25 of us.
Okay.
Yep.
Interesting.
It was very good. It was really valuable for everyone, and really high participatory from the teachers and staff. And then we were lucky to have our behavioral health clinician there that could help helps. I mean, that's not this, it's not the teacher's world really to be dealing with this kind of, the kind of things they're seeing. And not that we have the answers either, but at least it's nice to kind of make everybody feel like we're on the same page.
Absolutely. Thank you so much. That's fascinating.
So this is Tammy from.
Oh, yes, go ahead.
Oh, sorry.
No, go ahead, please.
Okay, so it's interesting because I'm building on what Molly has talked about in their statewide guidance, building on what Sandy has said and Jane has said, is that school-based health centers, whether you're, frontline staff, administrators, wherever you're at in that hierarchy, you have a chance to step into this void, because I think it is a void. And you can certainly start to become that connectional leader for the schools. Because you see the kids in a holistic perspective, and especially from a mental health standpoint. So you can begin to intentionally step in, provide some leadership, work with your sponsoring agency to partner with that, and get prepared. Get prepared to have these conversations, and get prepared to potentially be able to speak at a community meeting, tell your stories, share a little data, but the stories are what's really, really critical. And be prepared to talk to different target audiences, whether it be, at the community level, or maybe a county or parish level, maybe even a state level. But now's your chance to really intentionally prepare and become that leader that I think they're looking for. And so you can start to leverage those resources and those partnerships. And you need to be thinking about telling your story, because when budgets are going to be looked at, and they will be looked at, you want to be able to say, this is what we do, this is how we do it, and this is our key. This is what we bring to the table for these kids and for these schools as we're re-entering into this really unknown, crazy world. And so I would just build on what everyone said so far, is to really step up and think about getting prepared ahead of time and ready to have those conversations.
Great, thank you, Tammy. And one point to let all of you know is, if you do have a school-based healthcare alliance, a state affiliate of ours in your state, this is definitely a great chance to also connect with them and find out what some of the conversations are happening at the state level, and also to collaborate, get some support from them as well. So I just wanted to share that as well.
And if you have state general funds that comes down into the community to support your school-based health centers, go to your state health department or your Department of Education, wherever that funding source is, and, have a phone call with them and say, hey, remember to include us at the table in the conversations as you go to start thinking about what's it going to look like. And just be ready, because they will love to hear your stories and step into that realm of, what were you doing, what are you doing now, and what can you do, what do you see changing for the future to provide supports to the schools and to the communities in response to the pandemic trauma that's going to be affecting everyone.
I have a question to piggyback here with what Tam is saying. I just heard today the Student Success Act, that the funding that was coming to the schools on that it was supposed to be here to stay, and it was coming from taxes from corporations and that sort of thing, that money is no longer going to be here. So that's something that's going to change for the schools as well.
Yeah, that's a good point. Are others hearing about big budget changes like that, either at the local or state level?
Cece, I think you're right. And hi from Oregon. Cece's from Oregon. So but anyway, most everyone's going to have an impact budget-wise. It's just going to happen, whether you're tax-based for your schools, or funded by the lottery, or funded however you're funded. We're all going to be taking hits, and I want all school-based health centers to be prepared to find those partners, your school partners, your school champions, your families, your other helpers in the health world that know the value, that will stand side by side with you and say, we know budgets are going to be cut and we want to stay here and be here for the kids. So it's not a but, it's an and. We want to work with whatever we can work with and stand up for what you know is a really good model that can help get us all through this transition, even despite the budget cuts. They're going to happen. We just have to be prepared and be able to tell our story.
Anyone else want to share on that topic, that you're getting the chance to get to the table or trying to push your way to get to the table to have some of these conversations either locally or statewide?
I would mention that we're collaborating a lot, and since we don't have quite as much outreach going on, but we are collaborating with the local food banks. The YMCA, for example, tomorrow is doing a food distribution for families in need, and so we go and we wear our school-based healthcare shirts and the visibility, and we've done some other things, like the school did a parade with all the teachers, and we went by all the school's bus routes, and that was very eye-opening and very revealing, going through some of those really high need areas, and it kind of helped us pinpoint some families that we need to reach out to a little more and give a little more care to. And then for us, we've found we really have been in a place to be very supportive of the faculty and the teachers too, because it's been a really hard time for them. And normally with our school-based, we can see them as well with our family nurse practitioner, and they've had, it's been very hard for them. And we have behavioral health, and so it's we see it as taking care of the whole school as well as the students and the faculty.
Great, thank you, Sandy. Anyone else having the opportunity to do that, to help support staff members during this time in a variety of ways, or perhaps in conversations with them, like Jane shared about students' mental health, but also being able to support them with what they're going through. Is anyone else able to participate in that way? At this point. So we talked a bit about partnerships and with the schools and getting in these conversations to the table with decision makers. I'm wondering also if others have anything to share just around what you're anticipating your operations might look like within your school-based health centers when school does eventually start again. I see some people mentioning on Mentee more PPE or staggered staff. Any other operations differences that's starting to be toyed with or actual decisions being made on that you could share with the group?
This is Molly from Missouri. I think just from a state perspective, as we've been talking with our school-based health providers, we had many school-based health programs that were planning for opening this fall or had just opened. They did their grand opening maybe like the last semester, the first semester of this year. And so one of the concerns that we're hearing is, are they going to be able to reopen, or are they going to have to postpone their opening if they were planning on opening because of funding cuts and lack of staff, and they were in the process of hiring when this all happened. So we have so many programs that are new within the past 1 to 2 years, if not several months, that we're really worried about some of our programs not reopening.
Yes, I see a few people are saying worried about it even being able to stay open. Yeah. See, Sharon is sharing in the chat. Shannon, I'm sorry, is sharing in the chat box that they're working closely with the school to access funding to help students for food and utilities for those families out of work. That's fantastic. Yeah. Shannon, where are you located? You can put in the chat box or unmute yourself. Okay, while she's entering that, anyone else want to chime in on operations changes that you're starting to discuss?
This is Jane from Connecticut. I'll share what we've talked about. So it's all this unknown with what the school, actually the facility of the school will look like, the brick and mortar. But, you know, with the telehealth work that we've now, you know, pivoted to fully and really picked up a momentum, I see that we could potentially be expanding, you know, beyond the school year, beyond the school day. And we've reached a lot more families via telehealth too, because our providers' days are extended so that they can, you know, take care of their families and the needs of their own education of those kids and can work later in the evening. So actually families are more engaged, even whether they're back from work or whether they're home, they're more engaged. And then we just started to talk too about graduates, and I know there's lots of milestones that are going to be missed for so many of all of the graduates. But going forward, with telehealth specifically, it seems like we would have a easier pathway to maintain connections to those graduates, so that maybe we don't transition them to adult care, but instead we have sort of young adult care, and they could stay with the clinician that they're familiar with and potentially do that via telehealth. So those are a couple of the positive sides to all of this. You know, there's always that silver lining.
Great, thanks, Jade. Yes, I do see a few others in here mentioning continuing telehealth services. Does anyone else want to share how that's going and what you anticipate doing, whether it be hybrid or both of in-person and telehealth, or likely sticking to primarily telehealth when you first start up? What are some of those conversations looking like? And for those of you who are looking for telehealth resources, we did have a conversation through a listening and learning session last week, both on Tuesday and Thursday, about telehealth and school-based health centers. So we are placing lots of resources related to telehealth up on our base camp that you'll be invited to after the call today. Okay, I'm going to shift and see. Rebecca has shared in the chat box some interesting work that they are doing through a grant. Rebecca, do you mind unmuting yourself and sharing with the group?
Hi, everybody. This is Rebecca Doty. I'm the program manager of 2 school-based health clinics, one in Cortez, Colorado, and one in Dolores, Colorado. And we had a opportunity to apply for a very open line of grant funding through the Colorado Department of Human Services, Division of Child Welfare. And we were allocated $1,000, and we are working with the school in particular over here in Cortez, as they are more connected with our very high-risk, high-need students. And you know, it's kind of a first come, first serve. We are able to help them replenish their food pantry. They're helping someone with utilities, and they might be helping someone with rent. So, you know, again, it's about creating that really positive relationships with our schools, that we are able to help support them during this time.
How do you determine, thank you, Rebecca, how do you determine who to give the support out to? How do you prioritize that?
Well, we're actually relying on the school to kind of help drive that. We have been open during this entire pandemic. Our caseload has dropped significantly, but the school has remained engaged, obviously, with students doing the online learning platform. And so it is through their office manager and the school principal that you know, they're able to actually kind of connect with the students that call in and need the food boxes or are saying that utilities are cut off. So we, you know, I applied for the grant, we received it, and we're just passing it along. So we really don't have anything to do with who is actually receiving the funding.
Got it. Okay. Thank you. I see Amy put a question, Amy Carlson put a question in the chat box. chat box, has anyone considered how telehealth can be utilized throughout a regular school year when children return to school full-time, or are most planning to use telehealth for the interim reentry period only? We do have and it looks like Sandy chimed in saying that she was using, her site's using telehealth prior to this, and if anyone else wants to share, we do have quite a few sponsor organizations across the country who have been using either solely telehealth or a combination of telehealth and in-person care throughout the year that we can connect people to, but also are going to be having these conversations ongoing through Basecamp if that's something you're interested in finding more out about, Amy. But I think I saw Amanda on here before who's been doing telehealth all year, and anyone who might want to chime in about that. So anyone who's considering using telehealth throughout the regular school year.
Andrew, this is Amanda Martin with Center for Rural Health Innovation in North Carolina. And of course, we're all telehealth all the time, these 9 years that we've been running our program. So certainly it's not an interim solution for us, but we're really pleased to be able to start back as soon as the school nurses are ready to start presenting patients back to us. That's how our model works. So we'll be there for them, and we're still there for them right now. And I would just submit that, you know, to the rest of the group that I continue to be part of the let's put resources on Basecamp and answer questions and that sort of thing. So I'm available to y'all too, so don't hesitate. I see a message popped up in the chat. I love this question. She says, there are several types of telehealth. What type are you using? And that was a really great question. Right now, my understanding is that most people who are doing telehealth and calling something telehealth are maybe using video, right, to a device, like something like Zoom or DoxyMe or one of the free solutions. And maybe the patient at their home or sitting out in front of the library where there's free Wi-Fi, maybe they can turn video on. Maybe they can't. Some people are using telephone calls, like literally just a phone call and calling it telehealth. And I would say right now, that's better than nothing. You know, good for you. Carry on, take care of your kids. When I talk about my program doing telehealth all the time, I am not talking about the phone, okay? When we do telehealth, we're using a complete telehealth kit that is in the school nurse's office that includes the live two-way audio video, and then it includes the devices that make it possible to do a more comprehensive exam. So that's an otoscope, so you can actually see the eardrum, and a stethoscope for hearing heart and lung sounds, and then a handheld camera for looking at the rash or the poison ivy or the boo-boo closer up. So as far as an interim solution, when the students are not near the school nurse and near the school, yeah, we're using video only. But as soon as school's back in, my version of telehealth is always going to include a more comprehensive exam and not just video or not just phone. That's my soapbox. I'm going to jump back off of it now, but I'm happy to talk more about it if anybody wants to hear.
I like Amanda's soapbox. We turn to her a lot for her telehealth expertise. But it's a great question that was asked in chat box. It's true, there's so many varieties happening right now, but we do know a lot of organizations throughout the country who have been doing telehealth in their school-based health centers for quite a while and using the comprehensive model like Amanda talked about. Others who are using that or have just started to adapt and have some questions or learnings that you want to share in how you've added telehealth and what you're thinking about regarding continuing it. Okay, I'm seeing Cece saying challenges with well child visits with telehealth. Do you want to share or expand on what your challenges are that you're facing? Are you just talking clinically or
Yeah, clinically. That's the main providers. They need to get their hand in there, you know.
Yes, and we did kind of have
examination.
Yeah, we talked about this a little bit last week and on the clinicians call. Amanda, I don't know if you want to chime in a little bit about how you all manage that communication with the PCP and the well child visits?
Sure. So first of all, in our program across the board, we're not doing well child visits, right? We're an adjunct to the primary care office, and we are not anybody's primary care doctor. So unlike so many school-based health centers, we're not doing vaccines, and we're not doing well visits. So I don't personally have a lot of experience with it. I will tell you what I've been hearing, because as you can imagine, I'm in a lot of these conversations. There's some precedents for breaking the well child visit up, right? Where you can use video to do the information gathering, the advice, the history, and even if a patient is at home, they can step on a scale in the bathroom if they have one and point the camera towards the number. They can count their heart rate, or their parent can help them depending on the age you're serving. So there's like ways to be creative about doing parts of the exam. And then the splitting it part is to do what you can now, and then do the actual in-person exam as soon as you can actually lay hands on that patient again, even if it's a couple months from now, to have them in just for that blood pressure part, vaccine part, the short bit there. So there's that. There is some precedence for splitting it into two pieces and going with the idea that it's better to do some of it than none of it. Now, billing. Everybody wants to know, can you get paid? Well, the suggestion that I heard last week was that you go ahead and bill for the well visit when you do the online part, that's all of the advice and all that, and then bill only for a nursing level visit when they come in for vaccines and a quick peek in the ears. I'm not an expert in this, but that's what I heard. I see a question in the chat. Is there a requirement to have an established face-to-face visit prior to being able to bill or be reimbursed for a telehealth visit? Lauren, to some extent that depends on where you are, like what state you're located in. And there's a terrific resource that helps figure those things out. I don't know if Andrea can plop it in the chat, or I will. It's the Center for Connected Healthcare Policy.
Yep, I'll go drop it in. Yep,
Thank you.
Center for Connected Healthcare Policy. Yes, fabulous resource. I'll go pull it up.
They're really great. And the best thing there is that every one of y'all can go in and choose your state, and you can dig through and see what the requirements are, what the rules are, if rules exist, right? Because some states have rules related to telehealth saying, for example, who needs to be holding the equipment, or how fast the internet speed has to be, or what sort of training or credentials the presenter has to have. And other states don't have rules like that at all. Some want to say where the patient has to be physically located. We got rid of a little bit of that right now in the interim, but most states have some kind of rules about, a school-based health center is okay, but the home is not, for example. So you can look state by state and find out if your state has rules about those things. Right, yes. Exactly. Yeah.
Yeah, I see Lauren's, yes, chiming in saying Ohio recently relaxed the rules. Yes, and that's one of the pieces that I think everyone's wondering is, will these relaxed rules regarding telehealth stay in place?
And this may be an awesome opportunity to do a little quick advocacy in your state and say, hey, look at what amazing things we were able to do for our kids in these odd months when things were relaxed. Can we keep this part of the rule, please?
Definitely. Absolutely.
Oh, I see Tammy Alexander pop that Center for Connected Health Policy.org.
Yes.
So did Andrea at the same time.
And they're great. As Amanda mentioned, they are updating all the time to keep up. So checking back on their website all the time is great, because they literally stay on top of what each state is doing on a regular basis, updating their resources.
Well, and they're so good at it. I don't bother trying to keep track for my state because I know that they're going to do it for me. Like,
exactly.
It's really saying a lot.
Yes, yes. Absolutely. And a couple of the other telehealth resources I put in there, and some do are webinars featuring Amanda. We do have, and we've been running some webinar series with Jane Highland's group at the Weitzman Institute out of Connecticut that is covering some telehealth care in schools. So we do have some resources on our webpage, and what I put in the chat box is some links to some of the national telehealth resource centers that exist around the country. Not every one of their resources is specific to school-based, but some of them are just how to easy to grab checklists and trainings that are important regardless of the setting. And then some are specific to school-based. So we're working on continuing to gather those and share throughout Basecamp, but I did drop a few in the chat box already. Any other thoughts or questions about telehealth while we're talking about it?
Andrea, this is Paula with the School-Based Health Alliance, and I'm just curious if, as we're looking at reentry, what people are thinking around pushing for those expanded Medicaid reimbursement policies for telehealth.
Well, this is Amanda Martin again. I could tell you what I'm interested in is I would like to see the home to continue to be a site of care that's reimbursable, but with caveats, right? I don't think that we should consider a phone call to the home to be equivalent to in-person care from a reimbursement perspective. Not that you can't accomplish good things over the phone, but it seems like it would set us up for some nasty repercussions down the road of fraud and exacerbating disparities, between folks who have video and don't, and that sort of thing. I don't like it. But I still like the home as a site of service for some things with caveats. And then the other thing is relaxing, like let the school be a site of service. Let the school-based health center be a site of service if there are regulations around that.
Yeah, I was intrigued when you said, hey, show what you've been doing and what's possible and what can help reduce some of those barriers.
Yeah, and if you're in a state that has not really let telehealth to the schools be a thing, this may be your chance to say, hey, as soon as we had the chance, we jumped on it, and here's what cool stuff we did. And so all these kids that you were feeding by school bus and drive-through pickups and all these kinds of things, we were still serving them too. And so why don't you get out of our way, whether it's funding or regulations or whatever. I think it makes a lot of sense.
Thanks so much, Amanda. There's another telehealth question in the chat box, and I have a feeling, Jane, you might have some thoughts on this, or Lori. Amy Carlson says, sorry, I can't unmute at my location, but we're having great success using telehealth for our mental health visits currently while children are at home. But once in school, this becomes a challenge for us. We serve 3 schools and cannot get the schools on board with having students alone in a room for telehealth visits. We've had telehealth capabilities for 3 years and cannot get mental health going with kids physically in school. Any suggestions once we return to in-person practice to continue telehealth mental health while students are in a different school than the clinic?
This is Jane. I'm not expecting that to be an issue for us. I mean, we haven't gotten into that level of detail, but we are seeing, our clinicians are seeing students from all over the state. Just, as intakes come in and now it's a telehealth world, we don't feel like we have to identify every child with a particular school and the clinician in that school. Now things may change a little bit when schools reopen, where we may do some transitioning of some children, but I think we'll continue to see some children by telehealth, either, earlier, after school, early evenings, weekends. It kind of opens up the week to be pretty available according to the family and the child. So I'm not sure whether it's the individual school districts themselves that aren't getting on board, or so we have everybody on board as far as telehealth.
Right. Right. Yeah. Lori, any thoughts on that?
This is Amanda. Can I?
Oh, great. Yes, please, Amanda, go ahead.
When we're talking about mental health stuff, the requirement on the student end is to have a device, which doesn't have to be fancy or expensive, to have a reasonable amount of privacy, right? Which could be a conference room or an office that's not currently being used, and somebody to start the visit, right? And so it's not terribly complicated. What we've had in some cases is for a behavioral health visit, right? So not doing an exam, is the school nurse or social worker or whoever's kind of the connector, right? The instigator in that school will fire up the tablet, establish the connection, introduce the patient, right? So this is Timmy. His last name is Smith, you know, and this is the provider on the other end, and perform that introduction, which is also verifying identity, in case that's important. And then talk through the emergency plan, right? So, and how, not just the emergency plan, but also the what to do at the end plan. So Timmy, have a nice talk with the provider. And when you're done, just come step right outside the door. I'll be watching for you, for example. And I'll come in and turn off the computer. You don't even have to touch it. Or maybe it's, but then it's also the emergency plan, right? So like verifying that the provider knows the phone number to reach that person standing in the hallway, or the secretary across the way, or whoever for, you know, if Timmy's suicidal. Not a nice way to say that. So it may be that the schools are scared of what it entails because they don't want to assign someone to sit there and watch that kid through the window. And so I like to think sometimes people don't know what they're saying no to. I've certainly run into that once or twice with telehealth. Anyway, Amy, I don't know if any of that helps, but that's what I got. A little bit of a brain dump for you.
Just to piggyback on that, Amanda, is that if the telehealth visit were to be at home, we've used the camera on the device to ask the child to scan the room to make sure there's the level of privacy we expect. And then oftentimes it's the parent that helps us engage the child. So that's how we've used it for the summer now with schools closed.
Great, thank you. Thank you both. And Amy did chime in and say very helpful. Thank you. Lori, anything else you want to add to this conversation?
You know, regarding mental health, not really. I think Amanda and Jane have really covered it well.
Okay, great, thanks. Any other telehealth thoughts or questions? Okay, I think we've talked about a lot of the lot of the comments that you've entered in Mentee. I just want to open it up for any other broader comments, thoughts, questions that you haven't gotten a chance to ask or share related to reentry, what you're hearing, what you're thinking, anything else that you want to share while we have a few more moments.
Andrea, this is Amanda, if I can, one more time.
Yeah.
I'm really thrilled that we got a small grant from a community foundation here in one of our counties just to buy PPE. And it was a very attractive grant application to them because they had their COVID emergency response fund. And you know, they're not gonna fund a full position for multi-years. Like that's not the kind of money they're talking about, but $5,000 worth of masks and gloves goes a long way. And so I was really encouraged by that, and would suggest that y'all consider if there are little pockets of money in your communities that would let those foundations feel like they're helping, even if you're basically ordering it now, take delivery in July, and then use it in August.
Oh wow, that's fantastic, Amanda. Thank you. Someone else was going to chime in?
Yeah, I just wanted to make sure that a compilation of the answers on those questions you had. It's I'm interested in. Especially the one on the approaches for considerations on re-entering. That would be great.
Yes, absolutely. So after this session, what we've been doing is drafting up a summary report, both from the conversations and from the chat box and from the Mentee responses on the page. So we will email that out to you a few business days later. And then also invite you, and we'll post it on our Basecamp platform too, if you want to keep returning to that and seeing what resources people are adding.
Thank you.
Any other? Oh, go ahead, please.
This is Lori Swanson. I would like to share a little bit about us here in Colorado at the Every Child Pediatric School-Based Health Centers. We decided not to close when school closed. We actually have the luxury of being in temp buildings, or at least having outside access for all of our clinics. So that allows us to be able to remain open and still see kids. That being said, we really cut back a lot in terms of staff and how many patients we were seeing. All that changed. But we really restructured our clinics in a way that we could feel safe during COVID-19 and yet provide the services that the kids were needing. Our school-based health centers see not only the kids in the school, but the siblings of those children as well. So we felt that kids under 5 really shouldn't be neglected for their well child care during this time. They needed their immunizations, they needed their screenings for development, all of those things. So what we did at our clinics is we reserved the morning for well visits for kids 5 and under. And this might be something you can do when you get back in the fall. So the clinic was super clean in the morning. And so we would do one family at a time and request parents to just bring one person with the child. So we'd minimize the number of people in the clinic, meet them at the door, check them in, bring them all the way to the exam room before anyone else came in. And that way we had control of where our flow was and no people crossed in the hallway, and we could clean the rooms afterwards adequately and have a good process to ensure that we were, good infection control as well as we could do in this era. Then we actually allowed for some sick visits in the afternoon, trying to encourage most people to go towards telehealth. So we have a kind of a big old hybrid. So you'd have well in the morning, sick in the afternoon, telehealth throughout the day, and then any kiddo who we felt needed an exam, a stethoscope, something or other, we would actually even do some car visits, so visit them in the parking lot. So we've done a real hybrid of stuff, and it's actually kept our doors open. And I'm wondering if these are some ideas you can take with for your own school-based health centers as you start to consider reopening. Any questions?
That's fantastic. Lori, do you have, I know you have shared in some of our other work how you're operating like this. So are there some written policies and workflows that you've adapted around this that we could maybe post to base camps? Something that would, and we're going to capture what you said too in notes, but I know if you had some version as it with this new workflow.
We don't have anything actually written down, but I mean, I could try to do some kind of summary for all of you.
Oh, that's okay. Just didn't know if you already had
things you need to be thinking about.
Yeah.
Yeah, and we are going to require masks on all patients 3 and up, starting now. So
wow.
Into the clinic, they need a cloth mask. They don't need to be an official mask. It's just homemade masks. And it could be a bandana if nothing else. And so parents also need to have them. And so that'll be a requirement coming to the clinic. And I think Colorado's recommending masks at this point. I don't know about every other state, but they're not enforced. But we will in the clinic enforce. You have to have a mask to come to the clinic.
Have you stayed fully staffed during this time as well?
No, there's been a few people cut back. People have been asked to take as much PTO that they have or do some leave without pay. It's been kind of a mishmash of stuff.
Okay. Yep. It looks like a few other people are chiming in saying a hybrid model, like what you're sharing, might be the direction they're heading in.
And then we also had some staff working from home doing telehealth as well, trying to see them facilitate their own caring for their own children. And then we have staff that is high risk and they really can't be in the clinic. And so it's hard.
Yeah.
To figure all that out.
Yes. Yes, thank you so much for sharing that. That's really helpful. Any other questions for Lori or other comments to share?
Let me share one more thing. You really need to think through a good infection control policy and how you're going to ensure everyone's safe in the clinic. I mean, that's probably the biggest priority, how you're going to work through that flow. But then thinking more from a staff perspective, I think communication is, you've got to really have a good, strong communication plan. How are you going to make all these changes, and how often should we be doing a phone call or whatever, just so everyone is on board and doing everything in the same way? Because it's changes day by day, week by week. I feel like we're now more to the week by week phase, but initially it was a day by day, all the rules were changing, how we did everything. And so you need to really be planning to have regular team meetings, whatever that entails, as you get going.
Yes, thank you. Okay, well, we're coming towards the end of today's session, so thank you all so much. This was really fantastic and engaging dialogue, and we will definitely summarize, as I mentioned before, and share and continue to share resources with you and conversations to continue through Basecamp. If we could shift, we're just going to ask you a few closing questions, please, to Mentee. If you could go back to your phone or your browser, we would love to ask you a few closing questions just to help us continue to improve these listening and learning sessions and think about other ways that we can support the field moving forward. So our first question, and if you don't see it yet, you can just click for Mentee to advance you to the next question, is was this session useful for you? Okay, great. If we can move on to the next question, please. So we have some suggested potential following topics for our upcoming listening and learning sessions, and want to get your feedback. If you could take a moment to rank your interest in these listed topics below, and then we're also going to have an open-ended question next where you can add other ideas as well if you don't see what you're looking for here. So if you could take a moment to rank your interests for future listening and learning sessions, that would be appreciated. Thank you. Looks like supporting students and school staff is rising to the top. And then we've got mental health and trauma. Okay, let's go ahead and advance to the next question. And if there are any other topics or questions you'd like to see covered in future sessions that we didn't mention on that last choice question, please go ahead and enter here. Okay, we've got a few billing coming up on the screen. Billing and coding. I like the lemonade out of lemons. School engagement, okay. Free care is definitely been mentioned a few times. Okay, I think we'll move on, please, to our last question for you today. What suggestions do you have for how we facilitate our next listening and learning sessions? Is there anything operationally you would suggest that we do differently? We'd welcome any thoughts here. Great, and while you're finishing entering any information, the Mentee will continue. I'm just going to ask if we could pull up and we'll keep collecting this information, it won't go away for you to enter, but if we could pull up the slide that just shows our upcoming dates, just as a reminder. We'll keep sending out weekly email reminders and letting you know what the next week's topics will be, but just so that you can make sure to block them on your calendar. We have a few more weeks coming up of these sessions. And one thing to note for next week, it will be the 1 week that we are hosting these on Monday and Wednesday. We're typically doing Tuesday and Thursdays, but next week is Monday and Wednesday, and then we will return again to Tuesday and Thursday for that third week in May, or fourth week, third week. Well, thank you all so much for your time today. Please be on the lookout for follow-up emails from us. And we look forward to continued conversations via Basecamp and email, etc. We hope to see you next week. Thank you.